Hello, I'm Steve Main with Fitness for Five, here with Dr. Nario, Biointegrative Health Center in Reno, Nevada. You can look them up online if you're looking for integrated health products or services. So welcome, Doctor.
Hi, Steve. Good afternoon.
Okay, so today I want to talk and ask about viral infections. What is a viral infection? I'm assuming there's multiple different kinds, but tell me a little bit about viral infections. What are they?
Right. So, in the world that we live in right now, we're talking about, yes, the coronavirus. Now, the season of the flu is around us. A deeper understanding of a viral infection and how we can handle that is needed. And this is coming a lot in our practice lately. So defining viral infections would be these are organisms that are made of small particles of genetic material. So they're either a DNA or an RNA based type of microorganism. And the thing here is they're not capable of reproducing on their own. They depend on the organism that they infect for survival. That's why we have the flu, we have the common cold, we have chickenpox, HIV, COVID, and of course, infections starts when the virus proliferates or multiplies in our body, and then infects the host by introducing its genetic material into our cells because they need the resources. They hijack, basically the best word for that, the cell the cell's internal machinery to make themselves more in terms of the number. And then now you define an active infection happening in the system. And this is where the virus makes copies of themselves. And because of that amount of copies that's in the cell that the cell cannot contain, this will burst the cell. And then they come out again to reinfect other cells, and this results into cell damage, tissue destruction, and even immune responses that we see.
Okay, so I'm assuming that the immune system is something important when it comes to fighting viruses. So tell me how the immune system would come into play here.
Right. So that's a good question, Steve. So we have two parts of our immune system. It's called the innate and the adaptive. So the innate, I want you to make it way more simple for everybody. This is the one that's fast, and because it's so fast, it's the weaker of the two parts of the immune system. It's the one that actually is non-specific, may it be a bacteria or a virus. Somebody needs to meet them in the gate. They're going to be meeting up together. And this is more of when we talk about our physical barriers, like your skin, and you get a cut, and then you see inflammation there. That's your innate immune system acting up to prevent that infection from happening or for preventing that inflammation to get out of hand. And this is when we see trauma and also, yes, other throat infections that we see, which are fast acting. The other half would be the adaptive. The adaptive is a slower and stronger response to these organisms. So this is now specific and targeted. The best example that I can give you is the formation of antibodies. So when you give a vaccine, you don't form that immediately. You need time to develop that, and you introduce that specific virus or microorganism into your system so that the system would recognize. And once they come back to your system and invade you again, then your body is ready for that defense.
Okay, so are there people who are maybe at a disadvantage or we would consider, a disadvantage with their immune system or maybe immune compromised? Tell me how that would occur.
Right. So now we're talking about the immune system. So in a perfect world, the one that I described you a while ago, that's the perfect immune system. But there are people who does not have that perfect immune system. Thus, they're more prone to have infections. And who are these? So the ones that has an inadequate immune response would be number one, the old. meaning, of course, the wear and tear of the immune system had occurred in these people. Number two, the young, the ones who had not developed that proper immune system yet, who had not gotten introduced yet to all these organisms that the body should be recognized and be familiar with, and the ones who actually had acquired issues all throughout their life, such as the ones who has currently autoimmune diseases, for example, the ones who's undergoing chemotherapy, who is a cancer patient, and also the one who probably has HIV or other chronic viral illnesses such as hepatitis. So these are the ones that we are considering special, I guess, approaches for in relation to, yeah, the response to like vaccines or how much aggressive we should build their immune system up. These are the ones that are getting special treatments compared to the normal individuals.
Okay, so let's say someone is exposed to a virus.
Mhm.
And are there stages that the body goes through or the virus would go through? Does that happen? Are there stages with this, potential viral infection?
Right. So the body actually, when it receives a virus or when the virus penetrates the defenses, there are four specific stages that we go through. One would be, of course, what we call susceptibility. We become susceptible. This is when, for example, we get stressed, right? And the immune system just drops down. And that's when, after getting stressed, you had an outburst, and suddenly you feel your throat starting to be scratchy. So that's when your immune system started to get down, meaning your gates are opening up for them to enter. Number two would be now the entry of that specific infection. So this is the initial viral infection stage, wherein they now start to replicate. So they went into your cell, they used their resources, and now they actually have their own niche where they can actually now start to multiply again. The third one would be inflammatory response. This is when their body starts to recognize, hey, they should not be here. I need to do natural things to make them go out. And they launch an inflammatory response to kill and or even try to kill these viruses that invaded our own bodies. And lastly, after that attempt of the body to heal and kill that infection in the natural way, we have the recovery, the healing, and even the remodeling. So this is where everything goes back to normal again and everything's in equilibrium and homeostasis.
Okay, I know what that means. So you said there's four stages.
Right.
Is there certain things that we can do, or is there certain supplements that are specific to each phase? Is there some recommendations or advice you can give us on as the body goes through these phases? What should we do?
Right. So the thing here is I'm going to give you specific supplements here. So let's give COVID-19 a very good let's use it as a very good example for this one. So when I mentioned stage one, so this is more of really like the susceptibility part. When you become susceptible, you start to get or still feel sick. You have the initial symptoms. You will hear zinc a lot when we talk about COVID-19. So zinc actually is recommended at a dose of at least 30 to 60 milligrams a day. But you're in acute, or when you're experiencing acute symptoms, we suggest at least 60 milligrams or higher. And body does not really store zinc real well. That's why it has to be in a supplement form. And the thing here is it prevents viral replication so that the virus would not spread out faster and invade other cells. And the thing here is also has a good action for inflammation. And again, it's uh, so it's something that needs to work with another supplement to enter the cell properly to have a full antiviral effect. So that's where now the next stage of what we call uh, I'm sure you heard of hydroxychloroquine. So hydroxychloroquine actually is the one that is making the headlines, and it's something that's very controversial. I'm sure you're pretty aware of that, and people are not really yet. I mean, some professionals would not be accepting of it, but some are. So now we're going to go into the viral infection stage. Now we use what we call quercetin. So quercetin is the natural hydroxychloroquine. So when I say that is, it's because it's now the medicine that would make your zinc go inside the cell. So zinc will now get inside so that it can do its antiviral properties and attacks on the virus that's inside the cell. So quercetin, as we know, it's a popular allergy medicine, but we use this now in the dose of at least 500 milligrams 3 times a day if you are actually infected with a specific virus. And this again facilitates zinc to cross through the cell. And again, it has low bioavailability. That's why in supplement forms, it's available in higher doses. So these two you would need, and you would hear a lot when you have COVID-19. And then next would be having the inflammatory stage. Remember, the body now is starting to take over and kill the virus on its own. You can help the body by using curcumin. So curcumin is actually taken in the dose of at least 500 milligrams, at least 3 to 4 times a day. And this is actually used also as an antioxidant, meaning it lowers down that inflammation, contains it so that it won't be a systemic manifestation of the system. And then lastly, for the recovery period, this is where everything heals up. We use the supplement called bromelain. So bromelain is, you will hear this a lot when you use digestive enzymes. And this is something that we use in the dose of 600 to 2400 units a day in between meals. And this is something that reduces the inflammation in so many settings. And when you talk about healing, it helps repair that injured area or the injured cell to make it go back to its normal state again. So all these supplements, something that I would advise for somebody who's going through, in general, a viral infection.
Wow, that's great information. Very, very valuable as people are more conscious of viruses, flus, and all that. And it sounds like curcumin is beneficial for a lot of things. I take it regularly, so.
Right, right. And these are things that are, you would hear this a lot, especially, zinc. The zinc just flew off. If you knew the sales of zinc, it just skyrocketed during the pandemic because everybody just heard about the studies and the benefits that it does, especially for COVID-19.
You didn't mention vitamin D. Does that play a role?
Yes, big time. So vitamin D actually I have actual studies of vitamin D that was not only done in the US, but it actually has so let me give some tips about vitamin D. So the goal of somebody should be to be on the level of at least 40 to 60. That's going to be on the blood test that you do, which is the vitamin D 25OH. That's one you want to request from your doctor. And as a standard adult dose, at least 10,000 a day for several days, and then you can actually do 5,000 afterwards. And as proven, if you have low vitamin D, you have also an impaired immune function. And also when you have low vitamin D, you are promoting excessive inflammation. And again, in the light of COVID-19, vitamin D actually protects the lungs against acute lung injury and balances that cytokine storm. So that's another term that became famous when COVID-19 hit. And it supports also our immune cells to fight that specific virus.
Wow. Thank you, Doctor. Great information, great interview. Appreciate your input. Dr. Nario, Biointegrative Health Center in Reno, Nevada. Thank you, Doctor.
Thanks, Steve. Thanks for having me.
See you next time.